Welcome to my channel. In this video, we will discuss hypopharyngeal pouch. This is a concise presentation. So, let's begin. Pharyngeal pouch, also known as hypopharyngeal diverticulum or Zenkers diverticulum, is a pulgent diverticulum where pharyngeal mucosa herniates through the Killian's dehiscence, a weak area between two parts of the inferior constrictor muscle. What is pharyngeal pouch? It is a hypopharyngeal diverticulum or Zenkers diverticulum, pulgent diverticulum, where pharyngeal mucosa herniates through the Killian's dehiscence. What is Killian's dehiscence? A weak area between two parts of the inferior constrictor. I will show you in the next diagram. Etiology. Exact cause is unknown. May be due to spasm of the cricopharyngeal sphincter or its uncoordinated contractions during the act of deglutition. It is usually seen after the 60 years of age. Pathology. Herniation of pouch starts in the midline. It is at first behind the esophagus and then comes to lie on the left side of esophagus. The mouth of sac is wider than this esophagus, and obviously when the mouth is wider, then the opening of the esophagus and food preferentially enters the sac when the mouth of the sac is wider. So sac starts bulging and bulging. Clinical features. As dysphagia is the prominent feature, it appears after a few swallows when the pouch gets filled with food and presses on the esophagus. Gurgling sound is produced on swallowing. The undigested food may regurgitate at night. When patient is recombinant, causing cough and aspiration pneumonia. Patient is often malnourished due to dysphagia. The patients with pharyngeal pouch may have associated hiatal hernia. Rarely, carcinoma can develop in long-standing cases of pharyngeal pouch due to chronic irritation. Here you can see this is the Killian's dehiscence through which herniation occurs. Here you can see Lemmer's dehiscence, Killian's Jamieson's area, outer longitudinal fibers of esophagus. Here you can see cricopharyngeus and thyropharyngeus. Between these two parts of the inferior constrictor is the Killian's dehiscence. Here you can see pharyngeal or hypopharyngeal pouch or Zenkers diverticulum. Diagnosis depends on barium swallow that will show the sac and its size, and treatment is first one is excision of pouch and cricopharyngeal myotomy done through the cervical approach, then Dolman's procedure. The partition wall between the esophagus and the pouch is divided by a diathermy through an endoscope. This is done in poor risk debilitated patients. Third one is endoscopic laser treatments that is similar to Dolman's procedure. Partition between the pouch and esophagus is divided by carbon dioxide laser, above by diathermy through an endoscope, here by carbon dioxide laser using operating microscope. Thank you for watching.